I think the most important way to treat somebody is to use the golden rule, right? Is to treat somebody as you would like to be treated yourself. So oftentimes I think about, if I were a patient, if I had a medical problem, how would I expect a physician to be in terms of being knowledgeable, in terms of being caring, in terms of being attentive, in terms of being available? And that's that, is to treat others like you would like to be treated yourself. Right, so I'm a neurologist. So general neurology is one of my areas of expertise, but within neurology I have two specific areas that I concentrate. One is problems with language, so trouble with producing speech or understanding speech, or language in general. It could be written communication, it could be signs, etc. That is one part of my expertise. Mostly individuals who had a stroke will have problems with language, but not necessarily. Other neurological problems can also lead to language problems, so that's one of my areas of expertise. In addition to language, I'm also specialized in epilepsy or seizures, so episodes in which somebody loses awareness, loses consciousness, or has a seizure. So that is another area of specialty of mine within neurology. In addition to being a neurologist, I'm also a clinician scientist, so that means that I spend my time trying to understand better how the brain works, how the brain generates language, understands language, produces language, and recovers in the context of neurological diseases that may impair language. Part of my research is also related to epilepsy and epilepsy treatment outcomes. So I work with neuroscience to try to better understand the mechanisms of disease in neurology, and in particular how we can use that information to improve treatment. The reason for somebody to choose MUSC is because of the quality of care that we provide. MUSC is a large medical university where there are many subspecialties and many very competent doctors and many competent services that work in an interdisciplinary way, right? So it's very well integrated between the physicians, the nurses, the hospital staff in general. Moreover, because it's a medical university, there are many individuals here who are up to date to the latest knowledge and producing latest knowledge. Several physicians at MUSC or researchers at MUSC are responsible for generating new medical discoveries and new information to treat diseases better, to understand diseases better. So to be at the forefront of knowledge is very important for what we do, and also to provide the best type of healthcare that can be out there.